What a good girl.
Good.
What a good girl.
You're such a nice girl. Okay, so let's do, let's just try a little, this is can be a little tighter. It's not just draping, it's tighter. So just wrap it loose, but not draping. Do you know?
Mm-hmm.
Nurse? Nurse Ratchet?
I know.
She definitely knows how to do wraps.
Yeah, she does. Oh, there, she's got the whole wrap going. Good girl, Sharon.
Girl.
I know.
What a girl.
Really good. And she always had that kind of shape to her face.
Yes. Her sister does too. She's Shane's first letter.
Sure. Let's go.
Girl. Now you can use her. Sharon, let's go. Good girl. And mark it with that yes and good girl. Yeah. Her sister, on the other hand, is a little bit more rowdy. Good.
Good girl. Such good listening.
Okay.
She's so good with what she's doing.
I know. It makes a big difference. Jean is very consistent, very clear.
Yeah, it's very, that's, we were just talking about arousal level and it's so affected by the research.
I know. I agree. What could you follow me?
Do they,
This?
right. Good girl.
Do you dry your hair?
I've actually dried her
Oh, okay.
from the back.
You silly. Good job.
She actually goes away from it and blowing air and they go by
Vents?
the city vents to it. So you give her some food for coming up in here, but don't coax her.
Okay.
So one way you can do that is just put the food on the ground and let her choose to go to it.
I don't know if it's
So
going
closer
hot.
to her. And
Good
just some more,
girl.
put a little trail of it so she can. And then she can choose, it's okay. And I do that because blowing air is kind of a little bit of a sensitivity for it.
Good girl. She recovers really nicely.
She does, yeah, she just has to understand whatever it is.
Good girl.
Okay.
Nice
And then
job.
you can try to turn it up and then waving it out.
Okay.
That kind of thing, so. And feed her. She stays to the ground, that's great. And you don't want to say you're feeding her the whole time and she doesn't even notice it. Or you're putting her under pressure where she's like, I don't know the food guy, I don't really like it. She's chosen, she's fine.
Good.
Good girl.
Good job.
She's fine, she's quite sensitive. Okay. Very wavy coat.
Yeah.
Nice.
Okay. Oh, body handling, this part. Okay, so we're gonna mimic some vet visits.
Okay.
We've done that too, but the thing, okay, first kneel down and you want to do it like under her belly. Yeah, and then maybe across her chest, restraining hold. I can tell that you never do that. Now,
She's been over there, that Montgomery region.
and then what you want to do is we want to now kind of work on this, and I don't know, with her, I find that sometimes the stress, once the dogs, now you're moving around from the side to the front, and if you're asking for them to rest their chin in your hand.
Why don't you demo that one?
All right.
I've actually been working on it.
Oh, good.
Oh, okay.
Let me see.
That's right.
Okay. I'll show you what we've been trying.
Okay.
Sharon, chin. Show us chin.
What happens if you just place your hand there? Well, she doesn't have to walk into it. She'll just let you play.
She
We'll
will
start to place her chin on it.
Yeah, Denise is a little ahead of where she is. With
Yeah,
it,
well,
but I was
rightfully
just-
so. She's older.
Yeah, older, yeah. And we've been working on it a lot more. I have to sneak my work ins when Eric isn't there.
So that,
Don't touch my dog.
Is that what he says?
Yeah, don't touch my dog. I was like, okay.
that's a good, you said the body handling 3x3. We're going to also show you the other piece.
Okay.
I don't think we got to any of the dogs last time. We didn't do that.
Good.
What's the other piece? You're talking about manipulating?
Yeah.
Nice.
From the,
Yep.
from the behind?
Yep, because if they're doing this, then the dogs accept the other really nicely.
Okay.
I think that's the order we're gonna have to do it in.
That's a good girl.
But we are
Well, and
doing
the
this
other
in
thing that I've been
series,
doing too is like doing it from the side at one point and then moving to the front.
Okay.
Because don't you think that changes
so.
the?
Ken, let me kind of show you
Yeah.
what the real
Okay.
behavior that often the students
Okay.
and the vets end up doing.
Okay.
Oh, okay.
Okay, so, and she's a pretty good example.
Sharon.
Sharon.
I know, it's always black
Okay,
dog.
so she's so good with this that
Mhm.
we can do that. So this is the typical vet hold,
Mhm.
or the vet technician, so she's already there.
Okay.
Then the next piece, this is the first I would be able to do this with, is that another person comes up and starts to touch her muzzle. And say, and then- yes, and then you let go. And then you move from touching the muzzle to holding the muzzle so you can look in their eyes.
Okay.
So take something, it could be a spoon for all we care,
Okay.
Yes.
and
Good girl.
act like it's an otoscope and an ophthalmoscope. And so they're used to having somebody come really close with an item. But first they gotta be up and
Yes.
think, you gotta like
Good
hold them
girl.
for as long as it takes for a vet to look in the eyes. And then it's yes, and then you give them a break. So that's the next step, and then you work on the back end. So if somebody, pokes around their butt, and you can put a glove finger or something, you don't have to like touch their butt with your finger if you don't want to.
No, but sometimes even pressure around that anal area, they're like, ooh.
Yep, and then you'll actually,
Take a temperature somewhere along the way.
and that's what I was just gonna say, is you get a thermometer,
Right.
preferably one of the plastic ones, so you don't have to worry about it breaking. And just get them used to, of course, lube it up a little bit.
Right.
And then you have to think, okay, the vet's going to, move their legs around. And then the next thing they're gonna do, so that's the next steps for that, is they really are okay about holding still that way. And then this one is the heartworm test hold. And you just move them into this, because they aren't gonna say close, they don't know that.
Mhm.
And the first step to that is just simply that you can hold them and rub their, but she's fine. This is one of the first dogs we could actually show, this is like so cool. And then I'm gonna hold your leg up, good girl. And you can use food, not anymore.
Okay.
Food sometimes excites the dogs,
Mhm.
but it's nice to let them know that this is fine. And then you have them and you extend the leg, because you have to get your hand behind the elbow.
Mhm.
And that's good. She's like cool about that. That's good. Because it's new, I'm giving her for each one. And then you extend it and you actually put your thumb there and twist her skin. One of the shepherds hated that part. Fine about all the rest, but twisting the skin was like, oh, can't stand that. Then you have to do it the other way, because they may decide, not the right leg, but the left leg. And she's like, cool, anything you want. And then it's like, food, I'm fine. And then
Do they treat her though during the food? They don't do it.
No, but this is
Eventually,
teaching
they're
you.
gonna do it
The
without
whole
food,
thing is,
right?
then you work on doing some of this stuff on a slippery surface like a big cookie sheet, or some piece of something that's slippery.
Mhm.
And then here is the holding of the muzzle. What a lot of raisers do is their hands way back here. That's not okay.
Mhm.
They hold the muzzle, I just cradle it, and I make it really pleasant
Look at her,
for
she's
them.
falling asleep.
Mhm.
And you've done nice body handling. This is the best body handling dog I have seen anywhere in the whole program.
Yay!
And then,
She's like,
then you're really holding it, and then you're doing some ears. So I'll say ears, just like you've been doing with body. You put the two together.
Mhm.
You marry the body handling 3x3 with this stuff.
Okay.
And then the next step for, of course, would be teeth and open the mouth and stuff like that. And then they're just so wonderful. And then the last one would be down. That's a good girl. And then you just push them over by just gently having their bottom leg go forward. And you just start with that to start with, and then you can go examine under their pads, cut their nails,
she's like,
look
oh,
at their
this is
legs.
good.
And she's like, oh yeah, because they're used to over, girl, and then free. So it's without the niceties of, I'll ask you to lay over
Mhm.
and all of that. I'll ask you to give me your paw or whatever. This is like the vet, grab, do, and that's because that's what they learned.
Mhm.
And they don't know our dogs know that. So the dogs have to get used to it. So that was cool. That would be great if we can capture that piece of video, because this is the
Yeah.
first dog I've been able to show the next piece for.
Absolutely.
Except that you have black pants on, a black dog, and
You can't see anything?
you can't see very well.
Really?
No, not really.
Too bad I have the black pants on. Oh, look at least have some.
You wanna go change pants real quick? Use mine.